Welcome to the debrief show, the Fiji Dental Association team. Today, the crowd is really interested on what the progress of our dental hygiene and dental situation in our country is, and I think the team from Fiji Dental Association can highlight. And two of you are welcome to the show again. So Raman, why don't we start with you? What do you do? What role do you play in FDA? And also, what's your daily life like?
Okay. So I'm the secretary rather for the Fiji Dental Association, and I'm also the assistant lecturer at the Fiji National University. So I teach, and I'm also a practicing general dentist. So I'm a general dentist. I'm the secretary for the Fiji Dental Association, and I'm a assistant lecturer with the Fiji National University. So I teach students as well. I see patients daily, and yeah.
Okay, nice. And how long have you been practicing dentistry?
So I've been practicing dentistry for the last 6 years now.
6 years, nice. And ma'am, what's your role today?
Thank you, Rakin. I'm Anumala. I'm a specialist periodontist by training, and I work at the Fiji National University as an assistant professor. So I mostly focus on my specialty training. I teach undergraduate students and postgrad students as well. I practice at the Fiji National University clinics, and also I do locum at a private practice after hours. And I would like to thank Dr. Parish and Dr. Raman for inviting me as part of a FDA member. I've been affiliated with the FDA for um, a decade now. So there was a bit of a break, and then I've been a continuous member for the past 5 years.
Hmm. The general public often just sees dentists as people who pulls teeth, like that's how everyone sees it. So periodontist, what is that?
Periodontist, right? So it is a specialty that deals with gums and its tooth supporting structure. So Rakin, a lot of people only know this, that we have teeth that are in the mouth, that's it. But how are teeth held in the mouth? They are held by the supporting structures, which are called gums and the bone, right? And periodontics is a specialty field that specializes and deals with maintaining health of the periodontium, as we call it collectively. It also deals with managing periodontal disease, and also placement of implants and any implant related diseases that may occur.
So it's like, if someone just has like a entire like jawline damaged and everything, is that where you step in and assist?
Yes, simply put, the periodontium or the supporting structures are like the foundation, right? So if your foundation is strong, it's like building a house, right? You lay down the foundation first, and then you build the structures on top. So the teeth are not just hanging in the mouth, right? They are supported by the periodontium, which is the bone, the fibers, and the gums, the pink, brownish, depending on which color. So by the gums, right? So it is essential to maintain a healthy foundation if you want to maintain good oral health. And that is something that is very undervalued, unfortunately, I feel, in Fiji and the Pacific.
And how many people of your specialty out there in our country?
Unfortunately, I am the only one, and I hope that the younger generation or the new graduates would find their calling in periodontics, and eventually we would have enough periodontal specialists in Fiji and the Pacific to cater for the needs.
Now, Raman, one of the discussions we always had is that Fiji is having rising teenage pregnancy, right? And there's a lot of the current stat stands at around 500 young pregnant moms have come on has been reported by the government's data. That means a lot of moms will be expecting babies within the 9 months period, and they might not know the importance of oral health. So, can you emphasize for me your years of experience in this field? What is the importance of like maternity care, my bad, and then oral health, especially when it comes to taking care of children?
Okay, so when we think of oral health, we say that it begins at birth, but it's not the case. So oral health begins before birth as well, right? So while you were in your mom's womb, right, that's when your oral health began. So the mother's nutrition, the mother's oral health also affects the baby, and it affects what the mother eats, what the how mother's nutrition is like. That affects the baby, and how it affects the baby is also um, tied into the oral health of the baby as well, right? So Dr. Anumala can highlight more on how the periodontal disease can affect like the babies, and how it can affect the pregnancy as well.
The field, right? What are some of the let's just talk about the words before we talk about how we can fix it. So what have we actually seen? Like what have you seen in this field of young moms? So moms even like with adult kids, like like children with teenage kids. What have you seen in this field? Well, what they haven't monitored in terms of oral health and the damages that has done to their health system.
Okay, so during when a female reaches their puberty, right? So when you start your menstrual cycle, so the hormone levels, especially estrogen and progesterone, they are released on a higher level, right? So simply put, so women or females rather, young females may start to experience that their gums start to look a bit swollen, red, or even bleeding when brushing or eating, right? So that could be an impact of increased levels of those sex hormones, and that usually goes unrecognized. So if you tell me that when I wash my hands bleed, wouldn't you be concerned and you rush to the doctor, right? So same thing. So most people start experiencing bleeding gums when they're quite young, they're early teenage, late teenage, um yes, right? So but usually they just brush it off in
That
the
is true.
sense
Yep.
that they don't, because it does not elicit any pain, it doesn't feel very uncomfortable, it's just bleeding,
And we also
right?
like normalized it, isn't it?
Yes, so that's something that so if you have teenage sisters, daughters, granddaughters, or if you yourself are a teenage female teenage, and you've noticed that during your menstrual cycle your gums are bleeding, or your gums feel uncomfortable, it could be because of changes in hormone levels. So even little amounts of plaque show a bigger response because your hormones are elevated, right? So in that case, you'd have to work a bit harder on keeping the plaque levels low. Going back to pregnant women, I think a lot of people do not know that if you are pregnant and if you have periodontal disease or gum disease, right, there are chances of you having preterm. That means the baby arrives before 37 weeks. That's a preterm birth. A low birth weight baby. That means the baby is less than 2,500 grams in weight, or the mother can experience preeclampsia, right? And the most adverse effect would be fetal death, and these are all just related to having uncontrolled or unmanaged gum disease. It sounds very simple, but the reactions or the effects are quite severe.
Yep.
Right. So I think women need to be educated that when they conceive, they need to, or if you are planning to conceive, rather, let's start from there.
Yep.
Go and get a health checkup, right? Together with a health checkup, go and get an oral examination done, right? Visit a dentist and ensure that your dentist, ask your dentist, can you please check my gums as well? Because unfortunately, most dentists only focus on teeth, right? Because of various factors, right? So that is something that we can control. So pregnancy and gum disease, it has a bidirectional relationship, if that makes sense. One can affect the other and the other can affect vice versa, right? So pregnancy can also make your existing gum disease worse, again because of elevated levels of sex hormones. So in that case, you'd have to keep your plaque levels low, make sure you visit a dentist and get appropriate treatment done, right? So that the effects of gum disease do not trickle down to your unborn child.
And then, what's the demographic in terms of age are we looking at? I mean, you said conceiving mothers, so that's between the ages of maybe 18 and above to 30, 25. What's the number? Who are the critical for me?
Anybody of childbearing age, let's just put it that way, because I don't think it's ethical to say you can have a child or not. Like, it's a bit of a controversial area. So anybody who is at childbearing age, if you have menstrual cycle, you are at risk, right? If you are planning to conceive, then have your checkups done, right? It's just like when we want to travel overseas or applying for a job, they send you for let's just put the military example. If you want to join the military, right, they send you for a full body checkup, oral examination, so that you are orally and medically fit. So,
and then also, like, the thing is that since the pregnancy is an obs and gynae department, so I guess I'm assuming most people, they just prefer the regular doctors over a dentist, isn't it? Because they just don't see gum as the one of the places I need to be worried about. More like my weight and my other diseases and everything else is fine. So Raman, what have you seen in terms of some of the myths around this?
With the obs and gynae department, so they do have this ANC or the antenatal checklist that the pregnant ladies they have to go through, right? So as part of this, they have a dental checkup, right? But I think it's not a regular thing. It's just like when you get the folder filled, you just do a one-time thing, get it checked by the dentist, get it signed.
Is that initial checkup?
Yes,
and nothing in the next 9 months of pregnancy?
Yeah, nothing in the 9 months of pregnancy unless you have like an oral issue, right? That's when the patients or the pregnant women show up to the clinic. Right? So I think that's an issue there. And with myths, we have a very common myth that during pregnancy you lose a tooth, right? Yeah, there's a myth going around that.
How does that happen, though? Just in case, I'm very curious too.
So, like Dr. Mala was talking about periodontal disease. So that's usually well, for oral diseases, the two most common things are gum disease and dental caries, right? So the most common reason why you lose teeth is because of these two things. It's either the gum disease that you lose teeth, or it's due to cavities or caries that you lose teeth, right? So during pregnancy, like Dr. Anumala was talking about on gum disease, right? How pregnancy can worsen an existing gum disease that the pregnant lady might have, right? So because of that gum disease, the tooth might eventually become loose. And so there's a myth going around that when you conceive a child or when you deliver a child, there's a chance that you will lose a tooth. But that's not the case.
And then, is there like also like advocacy being done in that field about how much of this periodontal diseases are important in pregnancy mothers? Is there like a dedicated channel by FDA or Ministry of Health who specially focuses and training on the mom? Because I'm not a mom or female by any chance, but what I have observed is always the training on the taking care of the baby in the course of pregnancy, taking care of their personal weight. But how much of the emphasis on periodontal disease is emphasized?
I think periodontal disease as such is not emphasized in like specifically, but as Dr. Raman said, the folder or the checklist that they have, they do have an oral health component, but it's not because 9 months is a long time, right? So disease can progress, make or get worse during that period. So I think it should be more of a regular thing rather than like a one-off checklist. Like, okay, I've checked this box. So I think that's with gum disease, unfortunately, it's a lifelong thing. A lot of people come to me and say, okay, I'm here with you, you have done treatment, that's it. No, unfortunately, that's not it. Once you have gum disease, you have gum disease for life. Then you might ask, what is your role? Why do I pay you money or spend time with you when I will always have gum disease? Well, the idea is when you start off, let's just say you have gum disease, your gum disease status would be unstable, right? And from that unstable state, we want to bring you to a stable state, right? So once you come to that stable state, and it takes time and effort, right? It's not like there's no magic bullet.
Yep.
Right? It takes time and effort for both the clinician and the patient. Right? So once you come to that stable state, the idea is to maintain that, right? And how do you maintain that? You visit your dentist for gum checkup or your periodontist every 3 months, right? To start off with, right? And that is one thing I personally struggle with patients, because patients do not come back or do not understand the value of recall visits. So a lot of patients are lost that way, in the sense because there is no follow up. There could be two reasons for this. Either the patients were never informed that why they should be coming back, or the patients are not interested in coming back because of so reasons.
Is there a generalized fear also with dentists? I know I have the fear with going to the dentist, but then is that something we all have in general from the years of what you have seen? Because or what is that? Why is that a dentist is one of the particular field that we just try to avoid as much as possible?
A tough one, but the short answer is yes. Right? People fear a lot of things. Some people fear cockroaches. Does not mean we leave our houses and move somewhere else, right?
Yeah.
So same thing. Well, not the same thing, but in the sense that the how to rectify that problem. I think most people have never been to a dental clinic. So the whole idea should be, the first dental visit should be at 6 months, when the child or the baby is 6 months. So introduce them to the dental clinic, and then you go for your annual visits. So you are slowly making the patient or the child get used to the dental environment. A lot of people get uncomfortable with the smell. I usually ask myself, what smell? Until I go to a medical clinic, then I can smell the smell.
Is that the chlorine bleach kind of smell? Are we talking
It's
about?
just the disinfectants, right,
Okay.
which is necessary. But then, as I said, some people just, you might have heard of this, the hospital has a scary smell.
Yeah.
You know how we use our senses to identify things and places, so it's something like that. So I think just going to regular visits will help you get over that fear. Because I'll just give you a small example, right? When you are, how old are you, if you don't mind me asking?
26.
Right, you are 26. Let's just say your first visit was today, and you come to me with a badly broken down tooth, and I struggle for 1 hour to take that broken tooth out.
Yep.
You will blame me, oh, that dentist, probably because it's a female, that's another story.
Yep.
Right? I'm a feminist by nature.
Yep.
So that female dentist could not take my tooth out because was not skilled enough. No, my friend, it was your fault, right? Because once a tooth is really broken down, then dentists usually, I'm sure a lot of clinicians will agree with me, that it's a struggle to take out badly broken teeth, right? So those kind of fears, that instills fears. Or last time I went to the dentist, they really struggled with the tooth. So those kind of things.
So that first time interaction really sets the whole thing back.
So when you go to a dentist, when there is usually no issues, or from a very early age, you know the process. You are familiar with the chair, with the light, with the syringe that blows air and water. A lot of people are very jumpy with that.
I can vouch for that.
And the sound of the drill. I do not want to underplay the fact that dental clinics are scary, right? But so are so many other things. So are getting tattoos, right? So you spend how many 3 hours at a tattoo parlor getting tattooed, but you are scared of a dental needle.
Yep. Now gum infection is the common thing, like we have all discussed right now. So Raman, to the audience who are watching this, how do they get gum infection? Of course, like it's not just something that just builds up overnight. It's the the choice of food, smoking, and could be multiple other things. But what are the things people do? I'm more curious on the part, certain things we do and we think, oh no, I'm not gonna get this. Nothing's gonna happen to me because it's safe. I think a conversation currently happening on social media is that kava isn't as damaging as alcohol. So like, because people have got misconception that alcohol does more damage, kava doesn't, but we all know the story is otherwise. So in terms of gum infection, what are the things you have noticed and people needs to be aware of?
Okay. So, well, gum disease and dental caries both have been classified as a non-communicable disease by the WHO, right? So the only NCDs or the non-communicable diseases that we talk about are diabetes and cardiovascular diseases, right? That's the common one that we talk about and know about, right? But dental caries and gum disease are both also chronic NCDs, right? So the interesting thing about gum disease and all other NCDs, they are that they share common risk factors. Common risk factors include smoking, your nutrition as well, and the most important thing is the oral microbiome or the oral plaque that Dr. Anumala was talking about, right? So the plaque, what is plaque, right? It's not the same plaque as the plaque that blocks your arteries and you end up with a heart attack, right? That's not the same plaque. So the oral plaque or the dental plaque is basically the microorganisms that live in your mouth, right? So in our mouth is home to about 700 different species or different kinds of bacteria.
It's a whole ecosystem living in there.
Right. So there's a whole ecosystem there, right? And I'm just talking about different species. The actual number of microbes is in millions and billions, right? So these, well, not all of them are disease causing and dangerous for us. Only a few of them, we call it the opportunistic ones that cause disease, right? So what causes this gum disease and dental caries are the most are the problematic bacteria that we have in the mouth. And with that, if we have other risk factors that we share with the other NCDs as well, along with this, we can have like gum disease and dental caries. I'm sure Dr. Namal can explain more on plaque.
Yeah. So, Doc, like in terms of like the from the first visit to some of the foundation of oral health, like from the first years of life, both for moms and for the children, what are your suggestions on some of the preventative measures you have seen, and what would be some guidance you would give for those?
As mentioned earlier, try and introduce your children, even to yourself. It's never too late, right? It's never too late to start something new. So do it as a family activity thing, right? Take the whole family and get a checkup. And if there are problems, they can be detected and managed early. So rather than going to, you might have seen those memes that come in on social media rather. Dentistry is not expensive, neglect is. And they have like this dollar signs. The more decayed your tooth is, the more dollar signs are made on that. So that's exactly, it's exactly that, right? So if it's a small problem, it will cost you a smaller amount of money and time and effort, right? So um also diet in terms of there are what we well in terms of dental caries, which is tooth decay, what causes it, right? So in very simple terms, dental decay, which looks something like this, was for Raman. um looks something like this. It's usually as Raman said, you already have bacteria in your mouth, right? But not the bacteria is not able to cause disease all the time. It's when it's provided with a suitable environment. Same thing for gum disease, right? But we'll come to that later. So when you feed bacteria fermentable carbohydrates, basically sugars that can be broken down by those bacteria. So that bacteria plus sugar equals acid, right? So that acid starts to wash away or demineralize. I'll hold this up. starts to demineralize the white part, which is the enamel, right? And again, Rakin, this doesn't occur overnight.
Yep.
It takes months and years to come to this stage, right? So hence the neglect part. So once the acid starts to break down the enamel or the white part, it reaches the yellow component, which is the dentine, right? And then once it reaches the pulp, then you need root canal. So the more the dental caries or the decay spreads, the more complex the treatment becomes, right? And so this is basically about dental caries. And eventually, if the crown breaks down, the crown is the part that you see in the mouth, and the rest are covered by the gums, right? So if it breaks down, sometimes it becomes what we call a non-restorable tooth. So you may end up losing a tooth. Another thing that I find very concerning, people in Fiji in the Pacific are not hesitant to say, "Oh, my tooth is sore, take it out."
Yes.
Right. We have 10 fingers. If I ask you, Rakin, can I chop one of your fingers? How would you feel? You would be, get out of here.
Yeah.
Right. An irreversible thing. Like once you take out a permanent tooth, that's it. Well, you can get, yes, a denture or a crown or a bridge or an implant, but it's not the same thing as your natural tooth. So that's when I'm just jumping the gun.
No worries,
About
no worries.
myths. So that's one thing. It's like, oh, it's just a tooth. I have 32. So if I take out one, take out two, and by the time
I can still choose all good.
Yes. So,
how much emphasis has like the dental institution has promoted on or advocated on, like at least from FDA side, on the food habits? Because I feel like our country, it's a lot of many heavily processed food. So I mean, it's very hard to discourage people not to eat McDonald's and other fast food, restaurant food. It's just impossible, right? The conversation about diabetes and all that is a forever topic, I say. What kind of advisory guidelines do you actually give to your patients, and what would be some instant advice would you tell them to do? Because I also like I like one thing you just raised about like just pull out the tooth. I also heard like, why am I getting the gum diseases if I brush, right? Like as if that's the solution for everything. So Raman, what would be some of the things you have seen in this field?
Nutrition plays a huge role, like we had discussed, right? In terms of nutrition, like Dr. Numala said, that fermentable carbohydrates, so the simple sugars that we eat a lot, right? So in Fiji, we love our sweets. We love our, especially during kava sessions, right? We call
The
it
chasers.
chaser. Yes, we call it the chasers, right? I'm guilty of that as well.
Yeah, people doesn't even realize that's the double damage. Like, kava doing one damage to your liver and whatnot, and then you have the chasers, which is
Chasers that affects your not only your oral health but your other NCDs as well, right? So people love their chases, right? And these chases, right, or these sweets, whatever they take during conversations or whatever the time they prefer, they cause a lot of damage in the mouth, right? So what happens with, let's take an example, a lolly is an example, right? So if you're eating lolly, right, what happens in your mouth, right? So your bacteria that are living in the mouth, right, when they get exposed to this sugary environment, they start to digest that sugar and start to produce the acids, right? Once acids starts, it's getting produced, the overall environment in the mouth becomes very acidic.
Yeah.
And due to this acidic environment, we have dental caries occurring, and then we have also a condition called dental erosion, right? That's the wearing down of the tooth, right? So these are some of the habits that we have in the Pacific, that because of these habits, we have a lot of diseases, right? Yeah. So, and another thing that I see is that we, like different medical professionals, we love to work in our own silos, right? So, a dental professional will just work within a silo, right? So, you talked about nutrition, right?
Yeah.
So, who looks after nutrition?
The nutritionist.
Right. Nutritionists or dietitians, right?
Yeah.
So I think as a whole, we need to like have like a multidisciplinary thing whenever it comes to a person's health, right? And we should advocate for like interdisciplinary like
Yeah.
to work together and treat patients, right?
I have an interesting thought. One other thing I always talk about, like the fast food and ultra processed food. Whenever we're having nutrition and diet conferences, which Ministry of Health has ample of it every year. I think there's World Nutrition Day or something. There's something every year. How often have you seen in events like that, we actually get the food manufacturers in and actually talk about the type of food they're actually processing, or biosecurity maybe, and on the types of food they're certifying and importing? Have you seen those in those fields? Because I feel like they also play a key role here, because they're the main food producers in the country, but are they caring that the damage is doing to the oral hygiene? I talk about similar about diabetes in a similar in terms of sugar taxes. So have you seen these stakeholders come in and have a say?
Okay, the thing is, we can't really blame them,
Yep, true.
right? The thing is, you can take sugary drinks, you can have a poor diet, but you still need to take care of your mouth, right? So like I was talking about lollies earlier, right? There's nobody stopping you from taking lollies, right? Or taking any sugary drink, eating chocolates, right? That's all fine, right?
Yeah.
What you need to do is when you should be eating those things, and after you've eaten it, how are you supposed to be taking care of your mouth or your teeth, right? So we can't really be saying that, oh, we need to ban a particular chocolate brand or something, that, oh, these guys are causing dental cavities, right? We need to ban that. We can't do,
Yeah.
right?
True.
We can do what we can do is we can advocate, right? Okay, there's nothing stopping you from eating chocolate,
Yeah.
but when should you eat it, right? So ideally, we tell patients that try to eat chocolates or try to like take your snacks, junk, whatever during meal times, right? What happens is during meal times when you expose these things in your mouth, right? Like I said, that the acid is produced and it causes dental caries, right? So what happens during meal times is your saliva production is higher, right? And what does saliva do? It actually assists in reducing that acid balance, right? So what it does is
like an alkali.
Yeah. So your saliva is basically it neutralizes the acid in the mouth. So once you limit those junk foods, those snacks, those things during meal times, right? You're helping yourself a lot, right? Another thing is what some patients of mine do is after eating something, they straight up and go start brushing, right? What do you think? Is that a good thing?
I can't say much. I'm guilty of it. So, what would be your suggestion, Doc?
So immediately after eating something, ideally you're not supposed to be brushing straight after eating, right? The reason being, like I said earlier, acids are being produced, right? You need some time for the body or for the saliva to neutralize those acids before you start to brush.
What would be an ideal time period after dinner, or especially the dinner? I think is the biggest concern, because that's when people eat and boom, bread.
Yeah.
Yeah.
Boom, bed, right? So ideally you should wait at least 30 minutes after you've had your meal or whatever sugary or junk thing you've eaten, right? You should wait at least 30 minutes before you brush your teeth, right? If you brush immediately after, you're doing a bit more damage than good.
That's something very interesting for the public to take note of. Doc, I wanted to bring you back, because here talking about kids and lollies brings me to my childhood, and I think that's where, as kids in Fiji school system, that's the first time we ever come to contact with or importance of oral hygiene, because dentists, they do visits on the ministry. What are some of the challenges have you seen in the school, especially the school age children? Like, do you reckon the programs that are currently available or being carried out by ministry, FDA, maybe partnering up with them, is it effective? And if it is or if it isn't, what ways you reckon schools can even step in? Because going back to my primary school and high school, I can only think of, we only at General and college, which I'm guilty of public, we only had one brushing session in a whole year. Why? It was World Oral Health Day. So that time it was fine for me. I was like, okay, fine. That one time of the year, you have to bring a toothbrush from a school and brush with everyone for 10-20 minutes, because Colgate's gonna give you new tubes to take back home. Great. But growing up now, and when I look back, I'm like, is the importance of brushing on in school, at least during school time, only important once a year to align with host? So, what are suggestions and ideas you have in
Well,
that
I'm sure
sense?
you know the answer to that. Of course, it's not.
Mm.
Actually, I'm happy to inform you that when I was in primary school many moons ago, we used to have we used to take our toothbrushes to school and brush, well, more than once a day in
Yeah.
a year.
Yeah.
So yeah, so that was a good thing. And the choice of snacks were in my primary school, in my secondary school, was actually, well, in my secondary school there was no canteen, so that was a good thing. Bring your own snacks. Primary school, the snacks were mostly healthy,
Hmm.
so there was not a lot
But
of
why would you
sweets
say
and-
that a generalized overall field of things?
right. There are two schools of thoughts, right?
Yeah.
Yes, there are junk food sold,
Yeah.
right? You also have to look at the affordability. If
Mhm.
you walk into a supermarket,
Hmm.
right, and you look at the cost of healthy snacks versus sugary things, the sugary stuff or the junk food is usually very cheap.
Yep.
Compared to fruits, or and I'm sure some people will um refute that and say, oh, go buy local fruits, and of course buy local.
Yeah.
Right. But then in terms of, like, I don't know, snacks that are easy to carry
Yeah.
to school and whatnot, but even local fruits are not cheap.
Yeah.
Right.
Like and then coming back to Raman's thing of like having no one's gonna eat a pineapple as a chaser during cover session, isn't
Well, no, but why not?
it?
I don't
Exactly.
know, maybe people, you two should try it.
It's the experiment itself.
Yes.
Yeah, and we do subsidize. Like it looks like the choice of ultra processed food, sugary food is
Yes.
often more
So if
subsidized or
someone
cheaper.
is making $100 per week, right, you have to understand, will they buy basic groceries?
Yeah.
Will they buy toothpaste and toothbrush for their kids and their families? Will they pay for their bus fare? Will they give the pocket money to their kids? So this is just the tip of the iceberg. The problem lies deep.
Yep.
Right? So it boils down to cost of living. I'm not gonna comment on that, but you have to, rather than just saying, oh, this is the problem, why does the problem
Yeah.
exist in the first place?
And then what kind of things can school actually change in terms of? Do you think that we should do like a weekly programs and then maybe increase or have more dentists and oral hygienists visit our schools? Like what would be
I
an
think
approach?
already having that.
Yes.
Dr.
So-
Raman will be able to
Yeah.
comment
Yes,
on that.
so while I was with the ministry, we had this program, school visit programs. The thing is, we can't be everywhere
True.
all the time, right? So the thing is, it's just not on the schools, it's on the parents as well, the responsibility, right? So I think most schools that we've been to, they do practice this, especially out in the rural areas. They do have this practice of getting students to brush during lunch hour, right? So this is a program that was designed with Ministry of Health and in collaboration with Ministry of Education, right? So this is like a lunch hour toothbrushing. But I'm not sure what's happening in the urban centers, but in the rural centers, these things are still happening. But then again, nobody is there to actually see whether it's happening or not,
Yep.
right?
That's
But
another thing.
personally, when I've been to these schools, it was happening.
And how often has FDA reached out to businesses? Because I like what you said about that 4 days of work being affected. So I think they're choosing to get the tool pulled out because they lose 4 days of productivity and their bosses might not approve
Yes.
leaves like that.
We've had patients like that. It's like, Haria, I really have to go to work. And you have to understand, like, it's me losing a tooth or my kids not having food on their table.
And also like businesses should also and so Raman, I wanted to know as a secretariat, like has the FDA actually trained or reached out to businesses maybe through FSEF and their business network there in terms of telling the importance of their own employees treating tooth pains? Because I have seen certain people, employees who literally grind through that tooth pain because one, they don't want to lose other productivity, or something the bosses do not see that as a qualified sick leave, because unless the employee steps in and says I'm going to take a sick leave, but then or I feel like as a business owner myself, I would also be like, yeah, because he's grinding to the tooth pain, he's not so productive. Like he's not at his 100%, he's like doing 60 or 50%. So does the FDA have any plan to have some advocacy and training programs to actually make businesses understand treating oral pain as a different to maybe a traditional sick leave where you're just with coughs and sore throat? And then is there any data collected on what is the current oral infection and diseases we have in this country? How many tooths, like diabetes? I think what we have the kind data stands at like what 1 out of 3 people or 1 out of 5 people has
1 out of
diabetes.
3 people.
Every 5 or 8 minutes there's an amputation. I don't know. I mean, those are scary facts, but what's the data in terms of dentistry and oral hygiene situation? What demographic are affected? So is there any research on those?
What do you think the world population is?
I think currently stands at 8 billion.
8 billion, right?
Yeah.
Out of that 8 billion people, there's around 3.5 billion people with oral diseases, untreated oral diseases.
More no, close to half.
There's close to half of the world population that has like oral diseases. And the another thing about oral diseases is it's not like um, like you won't experience pain until it's too late, right? So it's like a silent killer kind of thing.
Yep.
Right? And our population in the Pacific are mostly like that. Like they won't show up to a dentist until they have pain.
Yep.
Right?
Mm-hmm.
So most dental diseases are like that, right? They're silent killers, right? Until it's too late, until the pain is there, they they won't show up to the dentist, right? So yeah, that's the thing. That's the reason why.
I think it's similar to even in terms of other health infections as well, right? Even
Yes.
diabetes, still like literally you stop feeling your toes and whatnot, then you'll be like, hey, maybe I should go to a doctor and check what's up, right? That infection looks very stinky, very bad, very infectious.
Yes, something similar.
Yeah. And whatever in terms of data collected by our own government.
Okay, our own data. The thing is, we've had the last National Oral Health Survey, which was in 2004. After that, I don't think we've had any since then. I'm not sure what work is being done on that regard, but I think as an organization, we try to work with the Ministry of Health and try to get a fresh survey done, because obviously the last data that was collected in 2004 is not relevant in
Also
2020.
20 years old.
Yes, that's like 21 years old, right? I guess getting the right people at the right place and getting things like organizing things is quite difficult. And like I said earlier, people love to walk in their own silos, right? There's like hardly any interdisciplinary collaboration, right? So that's one of the reasons I think there's like local data that's lacking. But it's not really, Fiji is not the only country with lack of national data. There's like a lot of
Yeah, it's a common thing in the region as well.
yeah. So
the reason I don't know, it's a conversation I guess ministry can hopefully answer the day if we ever bring them on. Ma'am, so like, what do you reckon the damage it does by not collecting such data? Is it then we just don't understand the scope of the issue? Maybe medical systems does not have the does not invest in the capacity for future, or like for example, we have a HIV epidemic in the country. Right now, there's a rush to build facilities, have the capacity to house all these patients who might be coming in for treatment, on all that, and and we are on like a time schedule like to get it done quickly. So if we don't collect data on oral health, does dentists actually understand the number of patients they are expected to see down the road?
But I think you've answered your own question. If you don't have the data, then it's not about the dentist anymore. It's about having the infrastructure and the funding and the budget allocated, not just to health in general, but there are different facets of health. And oral health is one of the most integral part. Like it, and people have to accept that yes, oral health is part of general health. So allocating budget to that and ensuring that the um, government clinics are sufficiently staffed and appreciated and paid well. They have positions, they have materials, they have equipment. So those kind of things. So if you have data, then you can show, okay, this is the magnitude of the disease and this is what we need to counteract that.
Yeah.
However, just seeing patients in and out kind of thing, the magnitude of the problem is obvious, right? We don't have exact numbers, but the problem is there, right? So, for example, going back to gum disease, we see a lot of a lot of adults from 35 to 45, which is very young, having severe periodontal disease. If you look at the prevalence of periodontal disease, right, in any given population, 5 to 20% of individuals will have severe gum disease, right, which can eventually lead to tooth loss as well. So the problem is there, the numbers are there, right? So if you collect data for gum disease, that's what you're going to find. 5 to 20%. What are we going to do with it? That's the issue, right? So you have to have a plan. Collect data, right? Just collecting data is not enough. What are you going to do with that information? That is the real issue here.
So like now moving forward in terms of the future, like so what have you heard? What is in Ministry of Health's pipeline? Have you heard a new project in terms of addressing this particular issue in this field, and also FDA, some of the vision maps? So well, let's just start with Ministry of Health. Like what have you seen in terms of strategic planning for this to address all this?
Okay. So probably I'm the youngest secretary for the Fiji Dental Association. It took me a couple of years to get the hang of things, right? Now, since I've got the hang of things, so this is my fourth year as a secretary, right? So this is the year that I've actually started to get like reach out to other stakeholders to get like their input on how we can collaborate together and bring more awareness on this. So I think our role would be in trying to work with all our stakeholders out there and trying to get everyone under together and starting this conversation on oral health and how it would affect, like you said, productivity, patients, person's quality of life, all these things. So the issue, I don't think it's just within Fiji alone. Um, Even globally, oral health diseases had been neglected quite a bit. Um, WHO only started to recognize oral diseases as an issue since 2020. So that's was like just 5 years ago. That's when like WHO was like, oh, okay, we
At the
have
peak of COVID.
yeah, at the peak of COVID, that's when like our international organization, the World Dental Federation, these guys, they've been doing advocacy for a while as well. But that's when these guys finally managed to get the WHO's attention as well, that this is an issue as well. So yeah, the conversation is just starting now, and yes.
So, Doc, what would be your final message to the public who are watching this, and what would be some awareness they have to understand the long-term damage they're doing with periodontal diseases, not maintaining gum disease, and even like visiting a doctor once a year, like even if they, and so I know a lot of people think that dental visits are expensive, but I mean, yes, maybe at private level because of the cost factor, but government, I believe, is about, it's little as $5, $7 for consultation. So it's pretty affordable, given they'll rather buy a stubby beer, which is $7, than visit a dentist in a whole year. So what would be a final message to all this audience who have understood all this information?
Okay, final message. I would say getting your regular checkups, right, with a dentist, and also please reminding them, can you please check my gums as well, not just the teeth. You know, I always make a joke about how patients come in when the gums are swollen, infected, red, but they want bleaching done. We have a perio joke. Or they would want pearly white teeth, but their gums are bleeding, their teeth are shaky, but still, it, you know how there's a thing, um, they people only focus on what meets the eye. We only focus on what we can see, which are the crown of the teeth, right? So please, emphasizing for clinicians, please pick up your perio probes and start assessing gingival health of patients. Um, for young individuals or for anyone that for that matter, there are two main risk factors. Well, plaque and bacteria is there, but there are two main proven risk factors for gum disease, which is smoking. That's a no-brainer. Smoking affects everything from the top of your head to the tip of your toe.
Mhm.
So, and everything in between, and your teeth, your gums, and the bone in your mouth are no exception. So, people, I'm just going to give you like stats, right? I'm going to
Yeah.
give you a fact. So, people who smoke and have periodontal disease,
Hmm.
their healing capacity is 36 years older than someone who doesn't smoke. That
Hmm.
makes sense. So, smoking ages your healing capacity by those number of years.
So like a simple wound will take much longer
Yes,
for
the
smoker.
wound healing itself
Hmm.
will be much slower. So that's just one, smoking, right? One thing that I would like to emphasize is that some people who smoke, even though they have very severe gum disease, their gums will not bleed
Hmm.
because of the nicotine that causes narrowing of the blood vessels. So it just makes the blood vessels thinner, so the blood is not able to flow to the gums. But it doesn't mean that you don't have gum disease,
Hmm.
right? And the second risk factor is diabetes. Diabetes and gum disease again have a bidirectional relationship. Sometimes the dentists or the clinicians, the dental clinicians, are the first ones to pick up that a person's got diabetes, right?
Hmm.
So if you have uncontrolled, I'm talking about uncontrolled diabetes, you will have more severe gum disease. And if you have gum disease, you will have difficulty controlling your diabetes.
Hmm.
Hence the bidirectional. One thing affects the other,
Yeah.
right? So that's, please, like, if you have family history of diabetes, if you know that you are consuming a lot of sugary foods, please just get your sugar checked every now and then, so that you know that you're in the right track. Visit your GP for that as well. So those are the risk factors. And obviously brushing twice a day, taking your time. Please ask yourself, how many times have you gone to a dentist, and has a dentist ever picked up a model, something similar to this, and actually shown you how to brush? If not, then that is a conversation that you need to have with your dentist.
Hmm.
It sounds very simple. I know how to brush,
Yeah. I've
right?
done that from the childhood, but I've been doing it
It's
wrong.
like combing my hair. Nobody will teach me how to comb my hair, but yes, there is a correct, sorry to pop
Yeah.
people's bubbles, but yes, there is a correct way of brushing teeth.
Hmm. Right, thank you. Raman, any final words from the FDA side and for the general public on advisory, and if they want to reach out for support and stuff, how do they get hold of FDA if they want to do some stakeholder partnership and some training in the workplaces? What's the mechanism?
We have a website. It's fijida.org. So they can visit our website, and under About Us section, we have the different executives with their email addresses there. So different organizations, they can reach out via that. And my last advice to the public would be on the importance of dental visits again.
Hmm.
The reason is, like Dr. Anumala was saying, that we can pick out your other diseases while you're visiting the dentist, right?
Yep.
So your dental visit might not only be about teeth. I've personally, in my experience while working for the ministry, I have personally picked out a lot of hypertensive patients, a lot of diabetic patients as young as 30-year-olds, right? So while we were due to the prevalence of these diseases, diabetes and high blood pressure, we had like a triage in place, right? So we used to triage all patients above the age of 30. So we used to randomly check their blood sugars, and we used to check their blood pressures as well. You'd be surprised the number of people we have diagnosed, like we've had to refer to the medical practitioner for them to be diagnosed as diabetic or hypertensive, right? So another reason why it's so important to visit the dentist. You might not be necessarily visiting your medical doctor regularly, but ideally you should be visiting your dentist regularly, right?
Right. So thanks for the very insightful information, both of you, for coming on the debrief show this evening. I hope the audience took away some very insightful information and taking care of their teeth. On behalf of the debrief show, that's a wrap.